Assalamu alaikum and a very pleasant good evening to all our viewers and listeners. Welcome to Doctor in the House at IBN Studios this evening. Tonight we will be speaking on education, enlightening and increasing awareness of women's health issues to be able to ensure that you make more informed health decisions and seek more appropriate medical care. The profession of medicine and surgery is vast and encompasses many different specialities. So in the next few episodes, we will be aiming to speak on obstetrics and gynecology, especially focusing on that for tonight's episode, as I realize that many people can still get confused. So let's take note. Obstetrics and gynecology does not deal with the eyes. That specialty is known as ophthalmology. I am Dr. Amina Khan. I am a specialist obstetrician and gynecologist and have been practicing medicine for over 25 years. I obtained my first degree at the University of the West Indies Faculty of Medical Sciences, followed by my postgraduate degree at the Royal College of Obstetricians and Gynecologists. I have been a fellow of the college since 2018. Upon my return to Trinidad, I was a consultant in the public health sector until 2011 and then branched off and continued private practice only. Currently, I'm an executive member of the Trinidad and Tobago Medical Association Central Branch, and our motto is to teach, treat, mentor, and advocate. Tonight, we would like to extend a special tribute to Brother Inshan Ismail, who recently passed. So we would like to extend very sincere condolences to his family and loved ones. There are many words to describe Brother Inshan. He was a trailblazer, a philanthropist, an activist, and an advocate who championed many different causes. The primary one of which being the establishment of the IBN Studios, which is celebrating its 20th anniversary in this month. So through his astute leadership and guidance, this station evolved from the fetal stage to the neonatal stage to toddler, to childhood, to young adulthood, and we would love to see it flourish well into its senior years, inshallah. We pray for Allah subhanahu wa ta'ala to bless him and reward him for all his efforts, and we would also love to see his dream of the Baraka Hospital come into fruition and materialize and become a reality, inshallah. I would now like to introduce my assistant, Mrs. Alicia Binder, who will be guiding us through tonight's proceedings.
Assalamu alaikum. Jazakallah for having me. Dr. Amina, before we start, I have one important question. Why it is we are wearing pink today?
Right, very good. Because it is Pinktober.
Oh.
Pinktober means Breast Cancer Awareness Month, and this is observed annually worldwide, and it aims and it's dedicated to raising awareness for breast cancer prevention, early detection, research, and support for all those who are affected.
Oh.
So it's important as women for us to know our bodies, to be able to detect any changes, and to be able to avail ourselves of the different modalities of screening that are available. And these would include digital mammograms, breast ultrasounds, and MRI if needed. So the theme for this year, 2025, is a very important one, and it is that every story is unique and every journey matters.
Jazakallah, very informative. I appreciate you sharing that with us. Here's an outline for what we will be discussing today. What is obstetrics? What is gynecology? Why both fields are vital and complementary? Common myths and taboos surrounding women's health. Importance of early checkup and preventative care, along with a preview of upcoming topics in this series. So, Dr. Amina, I'm excited for our viewers to have a beneficial, informative session tonight. My first question for you is, can you explain what is obstetrics and how it compares to gynecology?
Sure. Can we show slide 2, please? So as we can see demonstrated here, obstetrics is a specialized branch of medicine and surgery that is focused on the care of women during pregnancy, childbirth, and the postpartum period, which is defined as up to 6 weeks after delivery. I remember very succinctly one of my mentors emphasizing that we look after the health and well-being of more than one patient simultaneously. Can we focus back on us? Thank you. So when this was mentioned to us, I thought it was very, very interesting because we look after both patients, the mom and the baby, and that's 2, right? However, we know now that women can actually conceive with more than 2 babies at a time. So twins, triplets, and higher order pregnancies.
Speaking of that, Dr. Amina, did you know that the Guinness Books of Record have 3 cases reported for decuplets, which is women who carry 10 fetuses, developing fetuses in their womb at the same time?
Wow, that is amazing, Alicia.
Definitely.
So you know what that means? I will not actually probably see a case of that in my lifetime. But that's wonderful. So can we refer back to slide 2? Thank you. So moving on now to gynecology. And this field focuses on women who are not pregnant. And it focuses on the female reproductive system. We, as gynecologists, see women from puberty to menopause and post-menopause. As you can see outlined here, this encompasses quite a few of the conditions that we treat in gynecology. So it will include, from puberty, onset of periods, abnormal bleeding, menorrhagia or heavy menstrual periods, very painful periods, which is known as dysmenorrhea, endometriosis, uterine fibroids, polycystic ovary syndrome, infertility, contraception, infections including sexually transmitted infections, uterovaginal prolapse, premenstrual syndrome and premenstrual dysphoric disorder, perimenopause, menopause, and cancers related to the reproductive tract. And these can be any one of the following: cervical cancer, ovarian cancer, fallopian tube cancer, as well as uterine cancer. Thank you for that. So the field of obstetrics and gynecology is a combined field. Many of us are trained and practice both obstetrics and gynecology, or some of us can actually just practice obstetrics alone or gynecology alone. However, even within this specialty, there are subspecialties. So I will just discuss a few of them right now.
Sure.
And they include maternal fetal medicine. So these are obstetricians who are subspecialized in the care of women and babies with very, very high-risk pregnancies. So they do specialized anomaly scanning, which can detect any abnormalities, physical abnormalities in the fetuses, and then implement treatment if necessary. On the other hand, there are fertility specialists. So these are gynecologists who now treat women who have issues with fertility and conceiving, but it's a very highly specialized field, and it includes assisted reproductive techniques, or also known as in vitro fertilization.
Thank you very much for sharing. And why is it important for a woman to visit a gynecologist?
Sure. So that's very important because, can we just put up slide 3, please? So the field, again, is vital and complementary. So to ensure that women receive the right care for their specific needs at every stage of life, they should know if they need to see a gynecologist or if they need to see an obstetrician. Now, if you have one person who specializes in both, there can also be a seamless transition and a continuity of care from your gynecologist to your obstetrician and back to your gynecologist, okay? Because that one person can actually do everything. So if we refer to this slide again, we will see, for example, if you have fertility issues and you see your gynecologist and we recommend treatment and you become pregnant, you can now see the same doctor. And this doctor is someone whom you know, you're familiar with, and you trust that person. Also, if you have uterine fibroids or ovarian cysts and surgery needs to be performed and subsequently you conceive, it's a similar transition. And now, after you deliver, there is postpartum care. So we can discuss with you contraception and pap smears. Thank you for that slide. So the caveat to this, what I just discussed, is that if women have conditions known as endometriosis, and this is a chronic, debilitating, unfortunately very painful disorder that women need to seek appropriate care for. So ideally, they should see or seek specialist care from an expert who is now trained in laparoscopic surgery or minimally invasive surgery, where that doctor can perform very detailed surgery to treat and get rid of the endometriosis, rather than seeking care from an obstetrician or someone who only practices, who sees pregnant women. And that way they would ensure that they have the proper care.
Oh, very interesting. Thank you for sharing also, Dr. Amina.
Sure.
So my third question for you today is, what stages in life should a woman see a gynecologist, and how often should a woman come for routine checkups?
Sure. So in obstetrics and gynecology, we actually see women from puberty, as I mentioned before, right up until menopause and beyond menopause. But at each stage of life, there are different concerns and different issues that we can address. So from adolescence to young adulthood to adulthood itself, and then postmenopause. So can we show the following slide again? Slide 4, please. So, for example, the American College of Obstetricians and Gynecologists recommend that women initiate seeing their gynecologist from the age of 13. And between 13 to 18, we can establish a relationship with the gynecologist. And at that stage of life, women are pubertal and they start seeing periods. So we can now discuss normal periods versus abnormal. We can also discuss very irregular periods, if they have very painful periods or heavy flow, right? And all those things can be covered during the puberty age of that when patients see doctors. A very important factor to cover at this stage is also the human papilloma virus, HPV, vaccination. This is now available in Trinidad. It has been around for a long time in the public health sector as well as privately. And what this vaccine does is that it helps to prevent exposure to or if a woman is exposed to the virus, it will prevent the virus from proliferating and creating changes in the body that can lead to precancer or cancer. And it's a very important vaccine because it does not affect fertility and there are no known long-term complications of it. All right, so moving on now to from adolescence to young adulthood. You continue care here, and between the ages of 21 to 29, the focus is different. We now need to focus on preparing for pregnancy. This fertility window, of course, is a narrow window for women, and this is the best time to conceive. we have the best potential at this age of our lives. So we focus on that. We focus on family planning. We focus on safe sex practices, as well as screening for any sexually transmitted infections. And then we also discuss what we call periconceptual care. So women can come before they get pregnant, so we can optimize their medical health and history before they do actually get pregnant. So then the other stage of life will be adulthood. So it's between 30 to 65 years of age and beyond that. And this age now, we're looking at, Alicia, 40s and 50s. What does that equate to? Perimenopause. And the perimenopause transition stage of life. So in this, at this stage, we now look at preventing chronic diseases such as heart disease, hypertension, diabetes. We also look at addressing issues that will concern women concerning menopause itself. And now, because of increased awareness and knowledge, women are actually coming forth and they are more expressive, and it's no longer taboo to talk about menopause or how women feel. And that's very important because women need to be heard, to feel seen and appreciated. So we can discuss things like hormone replacement therapy if the patients are medically fit and they can actually use the HRT, because it will help them in the long term in terms of controlling symptoms of menopause, in terms of preventing osteoporosis, as well as things like dementia. Okay, and as I said, annually women should have checkups. However, it's not necessary to do a pap smear every year. So pap smears are recommended every 3 years from the ages of 21 to 49. And once it's normal, you can have pap smear done from the age of 50 to 65 every 5 years. And also, if women have concerns, they don't need to wait for their annual checkup. They can visit their trusted gynecologist at any stage of their life.
Lots of very beneficial information, Dr. Amina.
Yes, it is a lot.
What are some common myths and fears that women have surrounding visiting an OBGYN?
Women actually have fears coming to see the gynecologist?
Yes, of course.
Oh, I didn't realize that. Okay, so let's discuss. We can put up the following slide, please, so we can discuss those. So a few of them are outlined here. So I will just go through each one and then I can discuss it separately. So the first one is you only need to see your gynecologist when you have a problem. So of course that's not true. You can see, as I outlined before, you can have regular checkups without having a problem. The second one on the slide again, please. Examinations are only for sexually active women or married women. So again, in adolescence, you are not obviously sexually active, right? So that is another myth. Thirdly, you need to wait until you're older. So we already covered that. Next big one, cancel your appointment during your periods. No, 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 no. You definitely don't need to. You can still have your consultation and we could discuss other issues. And in fact, even during a period, women can still have their pap smears done. With the advancement in technology, we can perform pap smears even during your cycle. Although it's not the best time, but even if your periods are light, it can still be done and you can get accurate results. Women also assume that they have to prepare by shaving or waxing. That is not necessary as well. And you must be 21 years to see an OBGYN. Again, that's not true. Next slide, please. Yes, thank you. So the next common thing, a lot of women assume it's probably just an yeast infection. So there are many other infections, not just yeast. So it's not recommended to just go and use something over the counter. You need to see your gynecologist to be assessed clinically, to have tests done if needed, and then recommend the appropriate treatment. We discussed previously things like sexually transmitted infections. A lot of these infections can be asymptomatic. So we can't just assume that you have an yeast infection. Okay, slide again, please. A pap smear, I already addressed that, is not needed annually. Pap smears also test for sexually transmitted infections. That's not true. There are specific tests that test for STDs separately. A pap smear will detect all cancers. Again, that's not true. And I have had to address this recently with my patients. So a pap smear looks for pre-cancer cells at the mouth of the womb or the opening of the womb. That is not the internal area or the lining of the womb, and it's not testing for ovarian cancer.
Oh.
Okay, so that's very important. A few things again. So douching cleans the vagina. Again, that's a myth because we do not recommend douching. The vagina is a self-cleaning organ, and we do not need to use any scented products or any other products for cleaning. Okay, and the final one is a lot of women think that IUCDs, intrauterine contraceptive devices, are dangerous. And once you visit your healthcare professional who is trained in the insertion, the majority of times it's done properly and there are no complications, and it is a very safe and effective procedure, 99% effective in terms of providing contraception. And there are other hormonal contraceptive devices which also have the additional benefit of reducing heavy menstrual periods as well as alleviating painful periods. So in addition to contraception, it also provides that benefit.
So here first, viewers, throw all the myths and taboos out the window. Dr. Amina covered it for you. My other question for you is, how does early detection or regular visits improves the outcome of woman's health?
Right, so this is an extremely important question. So we always say prevention is better than cure. So we know that for sure. Many screening tests, and I'll describe a few of them in a little bit, actually pick up pre-cancer. So this is before cancer develops, and therefore you can implement treatments before that stage and therefore prevent the onset of cancer. Or if it's detected in the early stage, then this will improve the outcome. This will improve quality of life, and patients will have a better outcome. So can we put up the following slide as well, please? So when we use a proactive approach rather than waiting for symptoms, as mentioned, you have better long-term health. This improves survival rates, and you can have less invasive care and prevent complications. So the three examples that I have given, cervical cancer is number one, and cervical cancer screening. When we continue with our regular screening, it can, as I said, detect pre-cancer changes. With the implementation of co-testing now, we also do, in addition to a pap smear, something called the HPV testing. And the combined test, if it's negative, then women don't need a pap smear until 5 years later. And I know a lot of my patients would be very happy knowing that. But the additional benefit is HPV testing can detect your risk factor earlier, and therefore, again, allow you to be able to, if abnormal cells are detected, for example, then you can have a procedure known as colposcopy, which will treat you. When it comes to breast cancer, for example, this is very important. So women with stage 1 breast cancer, the 5-year survival rate is 99%. However, women who are diagnosed at a more advanced stage, or what we call metastatic cancer, which is cancer that has spread, unfortunately the survival rate is 30%. So 99% to 30%, that's a big difference. So again, it is important for us, we cannot emphasize enough the importance of not fearing getting your mammograms done. Please, it's not painful, and it's a procedure that will really help a lot of times. Finally, things like chronic disease prevention. So diabetes, hypertension, cardiac disorders, hypercholesterolemia. Some of it is familial, a lot of it is lifestyle and dietary related. So if screening is done by way of having blood tests, for example, and these things are picked up, similarly, early lifestyle changes can be implemented that will improve your outcome and prevent these conditions from occurring. Okay, so can you show the following slide as well, please, for some additional information? So the next one. Right. So with this one, this is just to highlight again, reading down below, the role of technology in early disease detection. So with advancement in technology, things like CT scanning, PET scanning, and MRI scanning, all of these have enabled us to diagnose cancers earlier, endometriosis, for example, and we can actually formulate a better treatment plan and an individualized plan for patients. Okay, and also the use of artificial intelligence, right? This technology has enhanced efficiency and accuracy of diagnosis. The final thing is genetic testing. Have you heard about that, Alicia?
No, I have not.
All right, so let's discuss that a little bit. So one example that I'm using is the BRCA gene 1 and BRCA gene mutation 2. Women who have these mutations okay, we will now go for a short commercial break and return to continue the discussion.
Welcome back to Dr. In the House. We will resume by continuing with our previous question, which is how does early detection or regular visits improve the outcome of women's health? Dr. Amina?
Sure. So as I was discussing before, overall prevention is better than cure. And by doing early screening, we are able to detect diseases earlier or even pre-cancer changes which can be treated. And this would lead to a better outcome of life and prevent complications. So the last thing that I started to speak about was the BRCA 1 and 2 gene mutations. So this is a genetic test that is done, and women who have been tested as positive for the mutations are at an increased risk of getting breast and ovarian cancer, amongst other types, but the female types are breast and ovarian cancer. So what this does, if it is detected, then women can have counseling, and they can be advised on what we call a risk reduction surgery or cancer sparing surgery. So they can consider doing a mastectomy, which is removal of the breasts, or a hysterectomy, which is removal of the womb and the ovaries at the same time.
Thank you for sharing that, Dr. Amina. Can you now give us a preview of the most common women's health concern, which we will explore in this series?
Sure. So can we pull up the next slide, please? Right, and can we zoom in a little bit? Good. So there are many different, as I outlined before, many different gynecological conditions that we can cover. So some of them will be, for example, any that are pregnancy related, we can do those, or infertility issues, menstrual disorders, which can include heavy, painful periods or endometriosis, as well as the different types of gynecological cancers. So we will try to cover those in the upcoming series. Cervical cancer, uterine cancer, breast cancer, or ovarian cancer. Another very important topic is that of perimenopause and menopause. So we will try to discuss that as well too. And in the second slide, again, just outlining uterine fibroids, ovarian cysts, polycystic ovary syndrome. Those are different topics that we will try to cover as well too. I would also try to complement some topics that are related to gynecology, so complementary medicine, as well as possibly some pediatric cases as well too. So before we conclude, I'd just like to highlight a public service announcement. So can we put up the following slide? So this is a donation drive that is being organized by the Aspiring Muslimat organization. It involves a ladies care package, and the package would include certain care products for women to benefit from. The average cost per package is $150. So those who are interested and would kindly like to donate, you can feel free to contact the following numbers that are listed on the flyer for further details and information. Thank you. You can talk.
Thank you for joining us on Doctors in the House, tonight's episode. For any further information, concerns, questions, whatever it may be, feel free to contact us on the number on the screen or email us at gyneadvice@gmail.com.
Right, so the number again to be contacted will be
The number, I don't have the number.
788-6249, or the email address as gyneadvice@gmail.com. So if you have any suggestions as well, or you'd like to make any comments on tonight's episode, feel free to reach out to us and we will try to advise accordingly. So this concludes our exciting program for tonight. We hope and pray that the information shared was of benefit to all, and that it was inspiring and you gain a little bit more knowledge of this exciting and this very compassionate field of medicine. We look forward to seeing you at our next episode, inshallah, and there will be a rerun of this episode on Saturdays at 1 p.m. We would like to say a special thank you to Almighty God for giving us this opportunity to be here today. I would like to thank Alicia very much for attending, and to our dedicated camera crew for providing all the assistance and cooperation with us tonight. Assalamu alaikum, and a very pleasant good evening to everyone.